Hi guys, welcome to the part 3 of February 2010 paper 1. Now we are going to continue the next question. Factors affecting wound healing is the next question. So what are all the factors which are going to affect the healing of a wound? So we will briefly look into this question. So the first thing is the site of the wound. Certain areas are going to heal faster, and at certain sites the healing may be delayed. Okay, which has a better blood supply is gonna be healing much faster. Okay, that's why it depends on the site of the wound. So, and it also depends on what are all the structures which are involved in case of the wound. Okay, now, so what is the mechanism which is causing this wound? It may be whether it is an incision, whether the wound is due to an injury such as crush injury is there, or it may be due to something like an avulsion is there. It depends on the mechanism of the wound. Next, it is going to depend on contamination. Any wound which is contaminated is always going to have a delayed wound healing. If the loss of tissue is more, then also healing is impaired. Now, tell me some of the local factors. Something like vascular insufficiency. Vascular insufficiency may be arterial or may be venous. Whatever it is, vascular insufficiency is going to have an impact. Any history of any previous radiation to that part is there, then it is also going to have an impact. And any pressure also locally. Next, what are all, I think you have been waiting for this, systemic features. So what is the first thing which comes to your mind? Diabetes mellitus. Yes. What is the next thing? Yes, very good. Steroids. Next, any immune deficiency status is there, such as AIDS is there. In such a diseases also, healing is going to be impaired. Or even smoking also can impair the healing. So in this question, I tried only to highlight the main headings which you have to use. Okay, on what basis you have to write the answer, if it is a 2 marks or if it is a 4 marks, depending on that you have to expand your answer. Okay, these are the just basic things I have written. Okay, this is enough. Next, coming to the next question. The next question is about cleft lip. Okay, cleft lip, it is the most common congenital abnormality of the orofacial structures. Write it down. Most common congenital abnormality of orofacial structures. Okay. Now, you have studied many syndromes which are associated with cleft lip, but I want to clarify you one thing straightforward is, frequently this cleft lip is a isolated situation. Means what? It is not associated with any other comorbidities or any other syndromes. Mostly it is isolated, but it can be associated also, you already know, it can be associated with other medical conditions. Okay, other medical conditions. For example, I am mentioning here congenital heart disease I am mentioning here. Okay, now, so cleft lip, cleft palate, both the things you will study hand in hand always. Why? Because cleft lip and cleft palate, their occurrence simultaneously is also much more. If you take a isolated cleft lip is seen 15%, whereas cleft lip and cleft palate it is in 45%, whereas isolated cases of cleft palate are 40%. Okay. Now, what is the etiology for this cleft lip? I want to tell you two things. One is genetic factors is going to have an influence on the cleft lip, and the other is environmental factors. Under environmental factors, I want to tell you maternal epilepsy is going to have an impact, and the second one is drugs such as some drugs like phenytoin, they are also going to cause cleft lip. Example, you can write phenytoin. Now coming to cleft palate, palate is of two parts. One is soft palate and the hard palate. When I am using the term cleft palate, it is divided into two. It may be the cleft which is present only in the soft palate, or cleft may be there in soft palate as well as the hard palate also. Okay. Now, can I diagnose these conditions antenatally? The answer is yes. I can diagnose. How to diagnose? Ultrasound I can do. Okay. Now the question is, after what period of gestation, after how many weeks we can tell or we can diagnose this? After 18 weeks. Okay. Generally on TIFA, which is done around 18 to 20 weeks, you can diagnose this. After 18 weeks period of gestation, you can diagnose this. Now, most of the babies, babies who have cleft lip, most of the babies, they are feeding well. They are feeding well only. They do not have any issue. Is there failure to thrive in them? No. There is no failure to thrive. They can thrive only. There is no failure to thrive. Airway problems commonly occur in these cases. Now, what to do if there is a airway problem? Hypoxic episodes occur in the baby. When they usually occur? At what time? They may occur during sleep, or they may occur during food intake, that is feeding. During sleep or during feeding, hypoxic episodes can occur in the baby. And even intermittent airway obstruction may also occur in these babies. Okay, what to do if there is an intermittent airway obstruction? I have to make the baby in which position? Prone position. Okay. Suppose if there is severe airway compromise is there. Now what I have to do? Obviously I have to do intervention. If it is a severe airway compromise, what I have to do? I have to do a intubation. Can you tell me what intubation has to be done? Oropharyngeal or nasopharyngeal? Yes, it is nasopharyngeal. The baby already have cleft lip. Okay. Now I have to do nasopharyngeal intubation. I want you to remember this. This is not, usually we will do intubation, oropharyngeal intubation, but in case of cleft lip, we have to do nasopharyngeal intubation. Okay. This cleft lip is one condition where nasopharyngeal intubation is indicated. Now, obviously, if the baby has cleft lip, I have to do surgery for that. That is why we are studying this in surgery. Now, what is the aim of the surgery? My aim of the surgery is always to get a normal lip, normal face and normal nose. Okay, normal lip, normal face and normal nose. This is my aim. Generally what happens is, there is no true hypoplasia. True hypoplasia is never seen in a cleft lip or cleft palate. True hypoplasia is not there, but what happens is, there may be some kind of displacement, or there can be underdevelopment of the muscles, and the facial skeleton may also be underdeveloped. So what I have to do? Functional muscle reconstruction I have to do. During surgery, I have to get a functional muscle reconstruction done. So now coming to cleft lip, cleft soft palate and cleft hard palate, when to intervene in these cases? If it is a case of cleft lip, I have to do surgery within 5 to 6 months. If it is a case of cleft soft palate, then also I have to do surgery within 5 to 6 months. If it is a case of cleft hard palate, then surgery, when to do surgery? 12 to 15 months I have to do surgery. Now what is the name of the surgery? So at least I want you to remember this name, that is Millard repair. Millard repair is the name of the surgery for cleft lip. At least this try to remember. Palate, if you ask me, if you want you can remember. The name of the surgery is Wardell-Kilner repair, and there is also some simple surgery, that is VY plasty. If you remember this, that's okay. Otherwise you can just remember surgery for cleft lip, that is Millard repair. Now coming to the next question. Next question is reactionary haemorrhage. Reactionary haemorrhage is the next question. Now first I will talk about the types of hemorrhage. Hemorrhage is divided into 3 types: primary hemorrhage, reactionary hemorrhage and secondary hemorrhage. So what is primary hemorrhage? Primary hemorrhage is the one which is occurring immediately. If it occurs immediately, I have to call it as a primary hemorrhage. Then what is reactionary hemorrhage? If it is occurring within 24 hours. If it is occurring within 24 hours, I have to call it as a reactionary hemorrhage. Then what is this secondary hemorrhage? It occurs after 7 to 14 days. That is your secondary hemorrhage. Now, why the hemorrhage is occurring immediately? Why? Because suppose a patient got an injury or an accident, what happens? Immediately there will be blood loss. Okay, due to an injury is there, or during surgery also this may happen. Immediately the patient will land into hemorrhage. Now why secondary hemorrhage happens? Secondary is occurring due to sloughing of wall of the vessel. So the vessel wall is going to sloughing off. That is why secondary hemorrhage usually happens. So why this is happening? Sloughing, why it is happening? Due to very important infection. So secondary hemorrhage is due to infection only, and sometimes even due to some pressure necrosis also this may happen, but I want you to remember at least infection. Now our actual question is about reactionary hemorrhage. It is the hemorrhage which is occurring within 24 hours. Now what are all the causes of reactionary hemorrhage? I have already mentioned here. So if there is any dislodgement of the clot, reactionary hemorrhage is going to happen. Due to normalization of blood pressure also this can happen. Due to vasodilatation also this can happen. Even with the slippage of the ligature also this is going to happen. Okay, I think you have already studied this in ENT. That is, which topic you have studied? In tonsillectomy you have already studied this reactionary hemorrhage. Okay, now management. I mean, obviously you have to write management for this also, reactionary hemorrhage, but management of a hemorrhage entirely I am going to discuss in a separate video. That is why I am not discussing here. Usually you have to write the management also. Next question. So next question is carbuncle. So what is carbuncle? Carbuncle is nothing but an infection. Infection of what? It is an infection of hair follicle. Okay, it is an infection of the hair follicle, that is carbuncle. Not only just an infection, This infection is something which is extending into skin as well as the subcutaneous tissue. It is extending into skin as well as the subcutaneous tissue. Then I am going to call it as a carbuncle. So can anybody tell me the etiology or the bacteria which is responsible for this? It is, everybody knows this, this is Staph aureus. Staph aureus is the cause of carbuncle. Actually what happens is, initially there is folliculitis. If the folliculitis is left untreated, then it is going to form a furuncle. This furuncle, if it gets complicated, it is going to form carbuncle. Okay, this is the sequence. Now this one, this carbuncle, you already know it is infection and inflammation, so it has to be red, it has to be tender, it has to be inflamed, and it is fluctuant. Okay, now what are all the sites where you are going to see these things? Posterior neck is one region. Second, here posteriorly in the neck it can happen, or it can happen in the back also. Back also it can happen, or sometimes you can see this in the thigh also. These are the three areas I want you to remember, and a small diagram denoting that. Here it can happen in the posterior of the neck, or it can even occur in the back also. Next, how to treat this case? I have to do incision and drainage. Sir, why you are telling incision and drainage? Why? Because it is going to form sinuses. It is going to form sinus tracts, and even it can cause pustules also. That is why the treatment here is incision and drainage under local anesthesia. Okay, under local anesthesia, and I have to give oral antibiotics also, obviously against Staph aureus. Coming to the last question in this paper, that is Bisgaard's method of varicose ulcer treatment. So Bisgaard's method is a method to treat what? Varicose veins, or you can say varicose ulcer. Now Bisgaard's method is a conservative method. I want you to remember a simple mnemonic for this: 4ME, for me A B C D E, for me A B C D E. I have told you A B C D E criteria already in malignant melanoma, that is different. Here Bisgaard's regimen, it is for me A B C D E. Let us expand this. What is this for? 4 means I have to do a 4-layered bandage. 4-layered bandage. What is M? M is for I have to do massage. Next, E. E means what? Elevation of foot. Foot has to be elevated. Elevation of foot. Next, A. What is this A? A means antibiotics. What is B? B means bandages. A, B, C. Next, C means cleaning of the ulcer. What is D? D means you have to do dressing. And what is E? E means exercise. This is the most simple method to remember the Bisgaard's regimen. So what is this? 4 means 4-layered bandage. M means massage. E means elevation of the foot. A, B, C, D, E. What is A? A means antibiotics. B means bandages. C means cleansing of the ulcer. D means dressing. And E means exercises has to be done. That is for me A, B, C, D, E, which is for Bisgaard's regimen. Okay. Yeah, thank you for watching.